SABC News, independent and impartial.
From an African perspective. Zambia's COVID-19 records show a positive sign as there's significant reduction in new cases, admissions and deaths recorded. But the Southern African nation is still grappling with low numbers of vaccinations, hence it has now turned into a sector vaccination campaign targeting what may be considered as secluded persons in society, prisoners. Our Zambia correspondent Arthur Davis Sikopo reports from Lusaka on this new development in the quest to attain health for all.
Zambia's COVID-19 records shows a positive sign in a significant reduction in cases and admissions, thereby less deaths being recorded. But the country is still grappling with low numbers of vaccinations. People seem not to be keen to be vaccinated, as many are relaxed even when a fourth wave is imminent this December, according to health experts. So far, the country has vaccinated a paltry 6%, against the targeted 70% of its total eligible population of 8.4 million. Zambia has a total population of 18 million people, but only 8.4 million are eligible as they have attained 18 years of age. COVID-19 vaccination in Zambia is still not yet mandatory, as people will have to choose either to be vaccinated or not. Noting that the numbers of those vaccinated are still low, the government is now turning to sector vaccination by targeting those in restricted areas, prisons, in a way to leave no one behind and boost vaccination demands in the country. Friday, the country has had a COVID-19 vaccination launched in prisons, starting with Lusaka after the national relaunch program weeks ago spearheaded by Republican President Hakainde Hichilema. Advisor to Zambia's president on COVID-19, vaccinology professor Dr. Roma Chilengi, during the launch of the COVID-19 vaccination in prisons, re-echoed the need for all to be vaccinated so as to have a healthy country.
In congregate settings like the prisons and other areas where people gather en masse, the risk of transmission of COVID is very high, and therefore very important that we prepare to mitigate against this infectious disease. Government on its part has been very active to try and advocate, to try and make sure we are ready, to try and make sure there are sufficient vaccines that are required for the people to be immunized so that we are better placed to deal with COVID. The President has given the directive that we must make sure that many people, if not everybody, get vaccinated.
The country today has a population of over 23,000 inmates against infrastructure meant for only 9,000 inmates, making the facilities more than 110% congested. Thence, the inmates are in more danger when viruses like COVID-19 strikes the facilities. A passionate appeal comes from a former inmate at Lusaka Central Prison in Cell 6, but now Permanent Secretary for Lusaka Province, Elias Kamanga, who says due to the closed-up spaces where these inmates are, vaccination is a matter of urgency.
COVID-19 vaccination campaign in correctional facilities. I call upon all of you to rise up and join hands in taking full responsibility and control in fighting the coronavirus pandemic. This is a matter of urgency, and it is indeed a matter of life and death.
The vaccination program launched in prisons has come to the daylight of Prisons Care and Counseling Association through Dr. Geoffrey Malembeka, its executive director, who says inmates' right to health should be respected.
And so they need, yes, to be given the best vaccine, but however, it should remain voluntary as it is outside. The beauty with incarcerated people, I'm speaking from experience, is that they are more courageous than even the people outside. If you ask them today to parade, the example is actually borrowed from the HIV. We were all tested. If you blow the whistle, they'll parade. And 99%, if not all of them almost, are test-free. So therefore, there will be no problem with COVID-19 vaccination as long as we intensify the awareness. That is where the gap is. So my appeal to the government is to provide enough resources so that they scale up and also recruit more health workers to partner with all of us that are supplementing the Zambia Correctional Service and Home Affairs.
As a country is tagging towards the attainment of Sustainable Development Goals, SDGs, on health, key populations such as inmates should not be left out. Reporting for SABC's Channel Africa in Lusaka, Zambia, I am Arthur Davis, Scopo.
In South Africa, those who will not be able to make it to the voting stations on Election Day on Monday will have an opportunity to vote this weekend. These are people who may be sick, disabled or elderly and who may be working on the 1st of November. Special voting takes the form of home visit as well as making one's mark at a voting station.